Welcome to PFD Always Ready. I'm Michael Severe. We're joined by a very special guest this week talking about the Papillion Fire Department and Rescue Unit as well. Dr. Andrew Hurd, who is the medical director for PFD and also, of course, works here at Midlands Hospital. Let's just first say thank you. I know how busy you are. We appreciate you taking your time.
No, I appreciate the time to talk with you.
Tell me what a medical director for a fire department does.
Sure. So every fire department that does medical care has a set of protocols, which is kind of the operating procedures of what they do when they encounter certain patients. So the type of treatments that they want to start, the evaluations that they can do. And so with these protocols, we have a medical director, usually a medical professional, in my case, an emergency physician. And basically I review the protocols with the leadership of the fire department. We go through what's practical, what's helpful for the patients, and with that we approve those protocols so that there's a framework for the paramedics and for the EMTs when they're evaluating and treating patients.
How long have you been working with Papillion Fire?
It's been about a decade now.
Wow.
So yeah, I've been there for quite a while and seen a lot of people come and go, and it's been a great department to work with.
You mentioned the protocols recently, well, 2 years ago now, we had to figure out what a protocol was for COVID. How did you help work with them in terms of transporting patients, how to handle that when that came up that March and April of 2020?
Yeah, so it's a lot of people involved in making new protocols, and it's certainly in such an uncertain environment. We used kind of state and local guidelines to try to help us. Obviously, there were a lot of federal guidelines that were coming out with the latest information that we had.
Changing every day.
Absolutely. It was, every day, every hour sometimes. So yeah, we really kind of compiled a lot of different resources to try to make the best decisions to protect our patients, to protect our paramedics and providers. And so between me, Carol Gupton, the other leadership, we were able to put together protocols to keep everyone as safe as we could, but also provide the care that we needed to provide.
I think people would be surprised how quickly protocols change. Not just for COVID, overall, medicines change, the way you handle maybe the way you handle a heart attack or a stroke. Sure. When those things change, you then get with the fire department, the paramedics, and work with them?
Yeah, absolutely. So again, there's multiple layers. There's EMS agencies that are more directed towards the pre-hospital care, and so we utilize a lot of their protocols and guidance. And yeah, there's new research coming out all the time, and so we try to incorporate that as quickly as we can to again provide the best outcomes for our patients.
Working and living in Papillion, I'm sure that makes it a little bit easier for you to be able to occasionally see paramedics when they come in the hospital. Sure. How do you guys kind of work together to give them feedback about what they're doing and to make sure they're doing the best job possible? Yeah,
so we do quality control, so we do case reviews. We'll do some random sampling to begin with, just to kind of look at a broad section of the cases. But they have great access to us, so we see them all the time as they bring patients in. They'll forward us cases they want us to review. They'll ask us questions. Hey, we had this case, and what would you have done? So we do have some good FaceTime. They allow me to ride with them on the ambulance from time to time. So it's really neat to see them practice in their environment.
I was going to ask you about that because being in the hospital, obviously you can think of what happened out there in one way in your mind, but if you're actually out there, how does that help you better understand what they're going through in the field?
Sure. So it really gives you a more practical understanding of what they're dealing with. When I'm seeing a patient, I'm in a climate-controlled environment, I have good lighting, and we have lots of extra hands. There's nurses and other people to help us out. Not always the case. They can work in dark, tight environments. They can be out in the weather. So they have a lot of other obstacles that, medically speaking, don't even come to mind when I'm seeing a patient because of the environment I'm in. So to be able to just see them when they work, to be able to provide some feedback from a medical side, but to also, again, understand the limitations they have, that just, I think, gives me a little better perspective, and it's fun to get to hang out with them and just, again, see how they do their job.
I assume they like having you there as well, right? Because, they can bounce questions off you.
They say that they do. They haven't kicked me out yet.
Right.
But yeah, I think it's a good time, and, when we go, obviously we sit and we wait for the call, so that's another time where we can do some run reviews, we can do some educational items if they have questions or, they want to talk about something in particular. We try to utilize that time as best we can.
In terms of signing off on everything, if a new medication comes along that better works, do you make sure that, I guess based off of the federal government, the state and local and everything, that it fits what Papillion Fire needs?
Yeah, so again, with the practical applications, we have to figure out how does it need to be stored and how much space do we have. So, they have a mini hospital room on wheels essentially. So Whereas I have a dedicated pharmacy downstairs, so we can carry just about every medicine. You have to sort of have some very practical thoughts about what you can carry and what can be used, again, in an environment that may not be, can it be refrigerated, and all the other things have to be done. So yeah, anytime there's new protocols or if there's new medications that we just haven't carried in the past. So, medicine does seem to come in cycles, so things will come in and out of favor. But yeah, between me and Carol and the other leadership, we go over the medications that we have and the dosages we want to use and those type of things. And then once we kind of have an agreement of what's good for the patients and what's practical and what we can safely use, then we'll institute those as protocols. So we'll have a list of that. And then we do education so that we're all on the same page and everyone kind of understands what we're doing with it.
In terms of being a full-time department, they haven't been one for a long time compared to some other ones, but how have you seen things change over the 10 years since you've been medical director?
Yeah, so it's just interesting, I think. Volunteer departments, I have a great respect for. They are given time, they're taken away from their times and time with their family. Lots of times they're leaving work to come respond. So I have a special respect for people that can give their time and energy to that. Having a professional department, I think, just gives us a lot more opportunity. So because they're physically there and we're not taking away from their other job, that gives us more time to do education. I think having a professional department, gives us more access to resources. We have, the sim van come down from UNMC in the past so we can do some mock drills. And then again, having some of the professional leadership like Carol Gupton, who can attend a lot of these national conferences. So, she'll hear a lot about what's coming down in the future of EMS, well before I will. So to be able to use her as a resource and go over, hey, we should be thinking about this, or, this is going to be the next greatest thing that has some very promising results, so that we're able to institute these things quickly.
They hire a new medic, a new paramedic.
Sure.
They come in, obviously they've gone through all the testing and all the classes and stuff. What do they have to do with you to be completely qualified?
Yeah, absolutely. So as you mentioned, there's state requirements for their education and their licensing, and they pass a national boards that basically ensures their competency so that they understand the treatments they can provide and the evaluations. Once they're hired on, they spend time training with the other paramedics. So we get some observation time to actually ensure that they're ready to go. Right. So again, it's a very different environment from a classroom to being out in the community. With that, I'll meet with all the new paramedics. We kind of go over the protocols. We make sure they don't have any questions. We make sure they're comfortable. After that, they meet again with Carol, and ultimately I'll sit down and meet with them as well. We go over all the protocols. We make sure they're comfortable and understand the practices and the policies that we have. And then once everyone's comfortable that they're ready to go, and once the provider's comfortable, then we'll sign them off to be fully independent providers.
And that, obviously, when that situation happens, when they're independent, they can go out there. They're still under your license, right? So you're like responsible for them.
Yep, and so that's why we still, want to be available to them when they do have questions. Right. Everyone has a learning curve as you get started. There's just going to be a difference between a new provider and someone that's had many years of experience. But they still have other paramedics that are usually arriving on scene as well. So even though they may be leading the evaluation and treatment of an individual patient, it's very rare that they're on a complete island by themselves, especially for the severe calls that they get to go out on.
What's your background? Where'd you go to school? Where'd you go to med school?
Yeah, so I moved here with my family. It was in the military, so I graduated from Papillion, La Vista back in 1996. So it's been a few minutes. Yeah. Ended up staying at UNO for my undergrad, then went to Nebraska Medicine for my med school. We went away for residency to do training in emergency medicine, but my wife's family's all from the area, so we moved back and been here for about 15 years since. Certain
amount of extra pride being able to work with Papillion Fire as a person who lives in the community?
Absolutely. So it's a great organization. So very dedicated individuals, real heart for the community. So yeah, I really appreciate getting to spend time with them and having the privilege of working with them.
Yeah. You work a lot, obviously. What do you do for fun? What are your hobbies?
Sure. So I love Nebraska, but I also enjoy the beach. We try to go skiing when we can. I have kids that are all teenagers now, so we spend lots of times at the local parks playing soccer and softball and those type of things. So yeah, it definitely is a full schedule. So.
There's no doubt about that. Well, we really appreciate you and thank you what you've done for the fire department and the city of Papillion.
Appreciate you sitting down and talking with me, Michael. Thank you.